One of the first questions most patients have when they come in to see me is, what is my stage and what does it mean? Breast cancer staging has become increasingly more complicated over the past several years. We now look at not only what we call the anatomic part of the stage, which is how big is the tumor, has it spread to the lymph nodes or other parts of the body. We also look at what we now call the biology of the tumor. That involves something called the grade, which tells us how aggressive the tumor is, how fast is it growing and dividing and trying to spread. And the other is something called receptors, which essentially tells us what's feeding the breast cancer. In the news, people have heard of a lot of different types of breast cancers. People hear breast cancers that are fed by hormones or estrogen. We call those estrogen receptor positive breast cancers. There's cancers that are called triple negative breast cancers. A lot of people have heard of that and know that that tends to be a more aggressive type of breast cancer. And there's another one that's called HER2 positive, which is considered aggressive but very well treated and responds very well to medicines we have. Given that, we take all of that into consideration, and that gives us your overall stage. Your overall stage more tells us about your prognosis, your survival rate from the cancer. It doesn't necessarily tell us how we need to treat the cancer, with one exception. If a breast cancer comes in as stage 4, which means it's spread to other parts of the body, typically surgery is not a part of the treatment for that type of breast cancer. It's focused more on medications. There are some exceptions to that, but that's for the majority of cases. Stage 1 through 3 breast cancer generally are all considered treatable breast cancers and possibly curable breast cancers that we do treat with surgery. In terms of how we decide which surgery, based on the stage, it's really more about the size of the tumor in relation to your breast size and whether or not it has already gone to the lymph nodes. Those are things that can impact what surgical options we have available. But always at the end of the day, it's a decision we make together, and the patient gets to say what surgery they would like to go with. I look forward to meeting you. Please visit us at basccancercenter.com to learn more about me and how to schedule a visit.